Hello there, many thanks for joining us on Razep Africa this beautiful day. As usual here on the show, we give you all the stories you need to know to keep you abreast with what's going on. We would later in the show get to discuss how to strengthen Africa's health systems in Africa through diaspora collaboration, as we have a guest who will be joining us to discuss that. But first, we'll begin with the Africa News Update. We'll begin the African News Update in Sudan, where authorities say the country has officially contained a cholera outbreak that began in August 2024. Sudan's Ministry of Health announced that the country has now declared cholera-free after new cases were recorded since January 14th. Health officials say that containment followed an extensive nationwide response that included distributing more than 20 million vaccine doses and conducting over 100 medical campaigns across affected communities. However, even as cholera cases subside, Sudanese health authorities are warning against the rise of other infectious diseases. Officials say that malaria, dengue fever, and measles cases are increasing in the several states, including Khartoum, the River Nile, White Nile, and El Gezira. The health minister has ordered stronger disease surveillance and vaccination campaigns as the government moves to prevent new outbreaks. Meanwhile, humanitarian operations in Sudan are also receiving a boost as the United Nations has resumed humanitarian flights in the country after nearly 3 years. The UN Humanitarian Air Service, operated by the World Food Programme, says the renewed flight will help accelerate the delivery of aid to communities affected by Sudan's ongoing conflict. The aircraft recently transported aid workers and supplies from Khartoum to South Kordofan, allowing humanitarian teams to reach remote towns such as Kadugli and Diling. Officials say the flights are critical for improving access to hard-to-reach areas, although security and logistical challenges continue to complicate aid operations across the country. Elsewhere in West Africa, Nigeria's Center for Disease Control is calling for stronger state action as the country battles a worsening outbreak of Lassa fever. Health authorities say at least 18 states have recorded cases, with Bauchi, Ondo, Taraba, and Edo among the most affected. The NCDC says 326 cases and 75 deaths have been confirmed as of mid-February, including 3 healthcare workers. Officials blame poor infection prevention practices, gaps in contact tracing, and limited access to protective equipment for the spread of the disease, urging state governments to release emergency response funds. That is it for the African News Update this morning.